Prakash, a consultant diabetologist, and a Life Care Hospital, Petavetera, Trichy. Today we are going to start a topic regarding how to take care of your heart in a diabetic patients. First of all, we want to know about what is diabetes. When the blood sugar is level more than a 140, we can we can tell that it's a diabetes. There are two types of diabetes. Diabetes is a type 1 and type 2. There are many other subtypes are there. The major is type 1 and type 2 diabetes. How the diabetes occurs in our body. First of all, when the blood sugar level, which is increased due to insufficient of insulin or lack of insulin, it leads to diabetes. So, what is related to diabetes and the heart? First of all, we want to know about the complications of diabetes. There are two complications regarding the micro and macrovascular complications. In microvascular complications is corresponding to uh, diabetic neuropathy, diabetic nephropathy, and diabetic retinopathy. Considering to macrovascular complications, which leads to heart disease, coronary vascular disease, and cerebrovascular like stroke, and peripheral vascular disease like gangrene of the foot and diabetic foot like that. Uh, First of all, we want to what is the related to heart disease? When the blood sugar level increases, there will be a depositions of cholesterol in the blood vessels, which leads to blood pressure, leads occurs the atheroma, and it leads to blood blockage called as a ischemic heart disease. Most of the diabetic patients which are admitted to the hospitals is related to heart disease, and the death mortality rate also is increased in a diabetic due to heart disease. So how we will going to prevent this related to the complications? We have to follow the coming up protocol related that we have to make ABC, like maintain the HbA1c level in a target like less than 7.5. By we can't able to take up medicines regularly, and we have if we want to take a regular medicines and we can't able to monitor the blood glucose level daily. So according to your titration of the dosage and medicines adjustment and the proper diet management, we can able to titrate according to the HbA1c level first. B, it's related to a blood pressure. When the blood sugar level increases in the blood vessels, there will be a depositions of cholesterol accumulation, so there will be an increase in the blood pressures. So if the blood pressure level is increased, when the blood pressure is more than 130 to 140, it can lead to blood pressure level. C is related to the cholesterol. In a cholesterol level, there will be a HDL and a LDL. HDL is a good cholesterol and LDL is a bad cholesterol. If the sugar level is increased, your LDL level will be increased, and there will be a lack of related to it can lead to heart disease. And related to that, second phenomenon is to maintain the diet, proper diet. In a diet, you have to what you have to do. We have to maintain a proper diet in a proper timing of foods. You have to take a less carbohydrates and proper fat content. You have to take increase in a high fiber diet with the protein rich content. If you with proper dieting, we can able to control the blood sugars level properly. According to that, third thing is regularly physical exercise and proper maintaining the physical exercise and the diet protocol. You have to sleep for at least to maintain your stress-free life. You have to sleep at least for 6 to 7 hours per day, and with the adequate dosage. Coming to the medicines, in a medicines you have to take a regular medicines which you have been prescribed by the doctors at a proper timing and with the proper medicines which have been taken. If you skip the dose and if you're not taken the properly adequately food at the time, you can lead to a hypoglycemic state. In a hypoglycemic state means your blood sugar level is less than 60 and you will have a palpitation, sweating, like that. It will be that sweating, anxiety, giddiness, slurring of speech, unconsciousness also it will be there. So if you take a proper medicines and proper dosage of thing and regular interval of food time, it will leads to euglycemic state, not a hypoglycemic state. Then alcohol and smoking. You have to quit the alcohol and smoking because it can leads to also mm, like it can leads to an ischemic heart disease and increase in hyperglycemic state. Finally, your recent updates of medical medicines like that, dapagliflozones and sulfonylureas and SGL2 inhibitors like gliptins, lots of varieties of drugs is there. If you are given this medicines, if the patients didn't control, we have to go for an proper insulin administrations. If you take a regular medicines along with your proper diet and physical exercise, and you have to reduce your stress free, definitely you are going to achieve the goal like diabetes control. If you control your diabetes 100%, it never causes the complications related to micro and macrovascular complications. So properly maintain your diets and your protocols you have to maintain. Okay, thank you.